Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Stephanie Desmond. Today, Johns Hopkins veterinarian Megan Davis joins me to discuss the avian flu outbreak that has been threatening birds and the food supply since 2021, an unusually long time span. She tells me about its impact on wild birds, the poultry and egg industries. You're not imagining those prices going up, and on humans. Let's listen. Megan Davis, thanks so much for joining me.
It's a pleasure.
So today, the topic is avian flu. And we've been seeing a lot of talk about it in the news. And I guess my first question is, why are we hearing so much about it? What's been going on?
So avian flu is nothing new in terms of the virus. It's been around for a while. We've seen this as a recurring problem in wild birds and also in domestic poultry, which can include chickens, turkeys, etc. They can be raised for meat, so broilers, or they can be layers and produce eggs. What's different about this outbreak is how long it's been going on. So normally with avian flu, and we call this high-path avian flu or HPAI, and it will pop up and you'll see a lot of bird deaths. You may see extensive culling to control the virus within the domestic poultry industry. And then it usually goes away. And you'll at the same time often be seeing some deaths of birds in the wild bird population and, concerns sometimes with migration and birds carrying it. And so what we've seen in this case is that it really kind of got started in 2021 and is still going strong to the point where you're now starting to see the effect of many years of this on the poultry industry and therefore on the supply of things like eggs. And so what I tend to hear a lot about from my colleagues is, oh, hey, what is it with these high prices of eggs that we're seeing right now? And of course, my answer is, and also we've had deaths of 58 million domestic birds and countless wild birds as well, although some of them will not show symptoms. But our domestic birds certainly can show symptoms and also die from the virus.
So it's a little bit beyond the price of eggs, is what you're telling me.
Beyond the price of eggs, exactly.
So do we see this slowing down, picking up, just going steady?
It has just kept going. And I think that's a real concern. One of the things I was doing just before we chatted was getting online where we have outbreak trackers for both domestic and wild birds that are put together by either the United States Department of Agriculture, USDA, or the Centers for Disease Control and Prevention, or CDC. And there have been some very large flocks that quite recently have become infected. And, what we typically have to do in these cases to prevent this from spreading into hundreds of thousands of more birds is, quarantine that facility and also cull the birds that are on the farm. And so this is part of what has contributed to the very large losses that we've seen on the animal health side.
And this has also now been found in humans.
It has, although there have been, I would say, around 9 or 10 human cases. I haven't done the count as of this morning, but the number has been pretty small. We've only had one in the United States related to the clade that we have here, which is different than some of the ones that are circulating elsewhere in the world. And so that's kind of an important distinction is genetically, what you see is that you might get a little bit of difference in terms of human symptoms based on the clade. And we've only had one here. It was someone who was in contact with infected birds in a domestic poultry flock. In fact, I think was helping with the control efforts. And this person had pretty mild symptoms, a little bit of fatigue, fatigue. It sounds like maybe a little bit of respiratory symptoms, but nothing severe. Certainly nothing like what we've heard recently with the death of the girl in Cambodia. Obviously, that shows just how severe it can be when you have a spillover event and you see a virus move from an animal population into a human population. But I can set this up a little bit differently. So with COVID, we had a disease that spilled over into humans and caused a lot of human disease and death. And it occasionally was found in animals and sometimes was severe. And we have the opposite in the case of the avian flu outbreak that we're talking about, because we have severe morbidity, which is illness and death within our domestic poultry, but only rare spillover into humans associated with any symptoms.
Are there, whenever I hear spillover, I know that that's sort of a, red flag word. What are we seeing here that it may be different, that more concerning than in previous years?
So I think the biggest concern is the longevity of it. In other words, we're just seeing it persist. I mean, we do see avian flu come and go. We know that birds and pigs play a really important role in reassortment of viruses that, they kind of switch things around. They have trading cards, right? And so these viruses get together and do a little trading, and then you can get a new virus strain emerge. And that's what we worry about with both our seasonal influenzas and also pandemic flu. Like we had the swine flu outbreak in 2009. That was a pandemic. So that was a pretty severe example of when you have spillover that can cause a lot of damage on people in terms of morbidity and mortality. In this case, most of the losses are with our food system, right? So the impact is largely to birds that are raised to be food producing. And in this case, we have, then a decrease in the supply of eggs and all of the attendant effects that can have on other food products that use eggs. So I was in the grocery store just yesterday and saw that I was restricted in the amount of dry pasta I could purchase because of the restrictions on eggs that were an important component of the pasta products I was looking at.
I didn't realize it had come to that.
Truly, the food system is incredibly complex. And I think that many people don't fully recognize the dependencies in the food system. So that you have maybe a perturbation, something that causes a problem in one sector can have these carry-on effects into other sectors in ways that you don't expect. We started to see some of this with COVID, right? Because our workforce was impacted. So the humans who were, in processing plants or at the retail, at the grocery store level, were, now having to quarantine or really, unfortunately, maybe had COVID or even had very severe disease and couldn't work. So because of this, I think we started to recognize that the system is a bit vulnerable. This is a different kind of vulnerability that the avian flu outbreak is showing us. It's showing us that production side. So when you start at the farm, at where you have the animals, what does that mean in terms of the food supply for people?
What can we do differently than we've done in the past to make this go away?
Well, certainly, when we have new viruses and new strains that are behaving differently, you first have to understand them. And so there are people who are working to try to understand better why this particular strain is doing what it's doing. But I think that it really comes down to what can we do to change our control strategies? And right now, what you see is that a lot of times the industry uses what are called biosecurity protocols. So they might restrict the number of people coming onto the farm. They might try to disinfect equipment. Some places, depending on the industry, will have more stringent measures. And we saw that there were some additional policies that changed. Like when I looked at what Maryland did, there was a restriction on movement of poultry litter. So that's, the waste products from the birds that can also be used as we'll just say soil amendment. I won't necessarily say this is not like fertilizer that you would purchase, but it does add nitrogen and phosphorus. And so it can be a commodity. And so there was restriction on whether that litter could be moved out of a certain certain area to try to prevent the spread. So a lot of what we've done in the past has really focused on what I would say is like the fomite trail. So the things that you touch or the things that go from one farm to another. And you'll see that this is very important because, farms are businesses. They need to have deliveries, they need to move birds, they need to bring in feed. There are a lot of different ways that things come onto and leave a farm. In this case, I think we've seen a larger role of migratory birds in transmission. And so thinking about biosecurity and biocontainment, so trying to prevent things from coming onto the farm that you don't want and trying to prevent bad things like viruses from leaving the farm, so that's the biocontainment part, might also need to consider how to restrict any access of wild birds to domestic poultry. And depending on the farm, the barns may be set up a bit differently. Some may have better or not as good kinds of restrictions, right? Doors, walls, etc., different ventilation systems. But you also have to consider things that can come in through the feed and trying to protect the feed from getting birds or rodents that infest it or come into, steal some of the grain, because that may be another avenue by which this virus can be spread. So it can be really complex, and really understanding that complexity, I think, is an important part of how we might do things better and try to prevent not just avian flu, but other viruses like Newcastle virus that can also cause a lot of disease in birds and impact the food supply.
Now, is avian flu coming from the migratory birds and then infecting the poultry, or is it vice versa?
It is most typically coming from the migratory birds and infecting the poultry. And what's really important to recognize is that some of these migratory birds won't show many or any symptoms. And so you may or may not see dead birds from the ones that are involved in the transmission. You do see some bird species that are susceptible, and there have been quite a few different ones, like I think eagles and vultures, for example, have been found with avian flu as part of this outbreak.
Is there any sort of end in sight to this particular outbreak?
That is the question. So the good, maybe encouraging news is that we tend to see surges of influenzas in the winter time, at least North America winter time. And that means that now that we're entering spring, we're starting to come out of that pattern. So my hope is that we'll start to see a lull in the cases because of that. And there are a number of different reasons that you have this kind of seasonality. Some of it has to do with the migration patterns themselves. Some of it has to do with the amount of sunlight and the temperature and the humidity and differences in terms of ventilation and containment, right? So the same things that we think about for people and our flu season, which is also happening, now and is hopefully on the decline. What remains to be seen is whether we're going to see it pick back up next winter the way it has up until this point for the current outbreak.
And I guess it's a wait and see.
Yes, indeed. Although maybe not in time to bring egg prices down anytime soon.
Megan Davis, thanks so much for joining me.
It's a pleasure. Thank you for having me.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.